You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction, a brand new technique, fairly new, Thermal Lipo. If you have unwanted fat that is not responding to diet and exercise, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. My first guest is Dr. Eugene Nowak. Dr. Nowak, welcome to the program.
Thank you, Randy. Thank you for having me.
Now, liposuction, hot topic, and you do a lot of it.
Lipo is what we specialize in.
Okay.
And it is an amazing procedure. It's come so far in really the short time, the last few years, have really made some big steps towards getting people better results, faster results, safer results. And it's nice because they see the results very quickly.
Okay, now you're doing what's called Thermal Lipo, and that's fairly new.
Thermal Lipo is new.
You're the first guy to do it in San Diego?
We're the first office to do it in San Diego, and it's really taken two procedures. It's taken the safety of a tumescent liposculpture procedure, and we're adding the skin tightening of a thermage. Thermage is a radio frequency. It heats and tightens the collagen support network of the skin. Combining the two, we can get more tightening for people, get them a smoother result, get them a quicker result, and make a big difference for them.
Now, why is it you like lipo? I ask you that because we've done hundreds and hundreds of shows now, well over 800 episodes, and I think I've met two, and I told you this, about two other doctors that like liposuction. Why do you like it? They say it's tedious.
Well, it's definitely tedious. It's definitely a physical procedure, but the results are amazing, and it's really, you can't replace these results with anything.
So the happy patients.
Oh, absolutely.
Okay.
The people coming in, when they look at their picture and they say, "Are you sure that's me before?" Because I don't remember looking like that.
Do they really say that?
They absolutely do. Absolutely say that. And we tell them up front that they're going to say that, and many of them say, "Oh no, I'll remember." But you get about 6 weeks. The pictures, we like to take pictures about 6 weeks afterwards. They've healed enough to where we can see the difference, but they're starting to forget how they actually looked.
Okay, liposuction, is it still the most popular procedure of all cosmetic procedures?
Of all cosmetic procedures, it's still number one. And it's still growing by leaps and bounds. Women by far are the main treatment area, but men are also coming in for the procedure.
Are they far? And what is it, about 50 or 70% women? And
it's probably about 85–90% women, and it's probably about 15% men.
So what's changed over the years with liposuction? We've talked off camera. You say it's safer today than ever. How so?
It really all came about with the tumescent procedure. The tumescent liposculpture, it takes away general anesthesia, it takes away the sedation, the risks that are associated with that. The people literally come in, they get some medication to relax them. The rest is done with local numbing medicine. So the patient's actually awake and alert. They're talking to us.
So they're not out?
They're not out.
Okay.
They're there talking to us during the procedure. We ask them to move and turn. They're able to do that. They're up and they walk out of there under their own power.
So who is the typical patient that comes in for liposuction?
The typical patient, it's really a broad spectrum. The procedure is opened up to so many different people. It's anywhere from people that are having a reunion, they have a wedding coming up, someone that just wants more shape and contour. Classically, you have a mother who, with the trauma of pregnancy, has lost some of that shape and contour, wants to regain some of that. We have people that are active. We have people in the military that work out every day but have lost that shape and contour, find that they're just not able to lose weight as quickly as they used to be. And we're able to make a big difference for them. Men, like I said, come in, they want the little love handles taken down a little bit, or they want to work on the chest, or don't feel comfortable. We have people that don't feel comfortable wearing clothes that fit tight, that have shape and contour that's hiding there, but it needs to come out.
Okay, what areas of the body are you doing liposuction? I mean, what's the number one area?
Well, the number one area would be across the midsection, and we really try to do as much as we can to make a big difference for the patient. So we would include the abdominal area, get into the waist and the lower back area. We'll try to come up and taper into the little bra fold area, and that's really probably a big concern for women. And we want to get into that some, but we really want to take more from the waist. We really want to bring them in, bring down that shape and contour, bring out what they have hiding underneath there.
Okay, arms, I mean, I guess any place that has unwanted fat.
As we tell people, what you can pinch is what we can take down a good portion of that. The midsection would be number one. Arms and legs would be probably the number two area. After that, people might come in and say they want to work on the neck area.
Knees? I mean, do you ever do knees?
Absolutely.
Is that right?
So we try to contour from the inner thigh right down to the knee to try to bring that down to get as straight and smooth of a contour as we can.
Is it true that you're getting a fitter group of patients that are coming in for liposuction?
Yes, I mean, definitely, you know, we have anywhere from the people that I've had marathon runners come in, and they just have areas that are stubborn, even though they're in great shape.
Even on a marathon runner?
Even on a marathon runner,
Okay.
they're in great shape, but they have certain areas that are stubborn, and sometimes it's a genetic, hereditary thing.
Like a
and
little saddlebag area?
They'll say, everyone in my family has that, even though I'm in, you know, the lowest weight I can get, I can't lose this. Anywhere to that, like I said, someone that's just had a couple children and is looking to regain that shape and contour.
Okay, now what about the upper range, age range of patients getting liposuction that you see?
Well, it really depends on the health of a person, and we do a pretty thorough health history, do extensive blood work to make sure they're the healthy person that they appear to be. The safety, like I said, we're not putting them under general anesthetic, so that we do have some people that couldn't undergo that procedure that can have this. But in general,
50s? I mean, people in the 50s, 60s getting liposuction?
Even into the 60s,
Okay.
absolutely.
Will the skin bounce back?
The skin is actually very elastic, and it's really a combination. The lipo procedure takes the fat or the weight off that area so we can bring that skin up, and it can shrink a lot. In addition, someone that has stretch marks, has wrinkling or rippling in the skin, we add something like the Thermal Lipo, adding the Thermage to get us some of that skin tightening on top of that, and their skin will actually tighten for up to 6 months after a procedure.
Okay, now I know you brought a lot of photos, and we'll get to those in a second, but help me understand. I guess the hot topic is thermal lipo. What is it? How does it work? How are you using it?
So thermal lipo is really a combination of two different procedures. It's taken a tumescent liposculpture procedure to give people shape and contour. But if they have concern about the condition
But what is
of their
tumescent?
skin,
I mean, help me understand that.
Tumescent procedure, it's local anesthetic. So the patient takes something to relax them, but the areas that we're working is just a local numbing medicine, kind of like you would go in for a dental procedure, but it's just infiltrated underneath the skin to fill the layer. It constricts the blood vessels, so there's little or no blood loss with the procedure.
Okay.
The patient's awake and alert, but they're comfortable. They're not feeling
So
anything
tumescent
more.
was the new thing, I guess not so long ago. And now the next level is?
The next level is thermal lipo.
Thermal lipo.
Yeah, because before that we relied on the patient's skin and the ability for
So this
it
is
to
not an
contract.
injection we're talking about. I mean, this is standard lipo, but
This is liposculpture. This isn't lipo-dissolve. This isn't where we're injecting a medication to try to melt the fat. This is where we're actually removing the fat cells.
You're removing the fat, okay.
We are removing the fat cells. Once we've removed the fat cells from that area, the fat cells are not going to come back to that area. So if people are going to gain weight, they could gain weight in other areas, but we've removed the fat cells.
so
from
this
those areas.
thermal lipo, the thermal is the thermage
That's the Thermage
portion of
So
it. And what does
Thermage
it
is
do? I mean, what's the mechanism that
Thermage
helps
is
with the fat
skin
loss?
tightening. By itself, if someone just comes in and has stretch marks, loose, lax skin after a pregnancy or some weight loss, we can tighten them up just with some Thermage. But if they need shape and contour, we combine the liposculpture. The radio frequency heats the collagen support network of the skin, so we get a shrinking and tightening effect. We get some tightening pretty quickly.
So you're doing it at the same time, and is it two instruments under the skin?
Right afterwards. So I'll do the liposculpture part, and then immediately afterwards we'll go with the Thermage, and it's applied directly to the skin. So they're done on the same
Does it
day,
help
the
break
same
up the
visit.
fat by any chance, or even it out?
It does help give a smoother result because we get that shrinking and tightening of the skin, the collagen support network. We do heat the fat a little bit, but the main part is removing the fat for the shape and contour, and then going in and getting that tightening for them.
Okay, do you believe there's art to this, by the way? Because it seems like a straightforward procedure.
There's definitely art to it. The first is getting the patient's expectation. The next is marking the patient. So you look at their shape and contour and their proportions, and we're trying to take and maximize what they have and really contour them. Yes.
Okay, now you say you're changing people's lives.
We change
But
people's lives.
they act differently after they get the procedure.
They do. Well, they act differently. They look differently. Their clothes fit.
So
them
because their
differently.
self-esteem.
So they do. So
raised.
you can take a look at a patient like this
All right.
one here. On this patient, we will look at the bra fold area here. This is a common area of complaint for women.
So on her back, that fold.
Now, most people will look at this and say this patient needs a tummy tuck. This is
Do
someone.
they say that? Do patients ever come in and say, "Doctor, I need a tummy tuck"?
Patients absolutely come in and say, I've been told a tummy tuck is my only option. I don't want the scar. I can't have the downtime, the recovery time. What can you do for me? So just with the lipo procedure, we can bring this up, give them a much better shape and contour.
When you look at this, by the way, on the console, do you say, "Wow, this is going to be a good result"? Does that go through your mind?
Absolutely. It's really, it takes examining the patient, talking to them, examining, we try to show them to feel where their muscles are at, because that's what we're doing. We're bringing out the shape and contour that's hiding underneath there. If they had shape and contour before, they're going to have it when we're done. Now look at the after. You can look at this area here.
Very
I mean,
nice.
look how all this has come up. You know, look at this patient. We gave him a shape and contour. This person can wear their low-cut jeans.
Looks like they lost 35, 40 pounds.
They don't.
I mean, how far out is that after, by the way?
This is 6 weeks. So all our pictures are taken.
Nothing is touched up.
Nothing is touched up. All their patients pictures are taken about 6 weeks afterwards. You know, this person can wear the low-cut jeans. They can wear that tight dress. You know, they're going to have that shape and contour.
They're dressing differently? And
there's some people that when they come for their first visit, they tell us they've already been out shopping looking for new clothes because they can already see a difference that quickly.
How many sizes?
We tell them to wait until they get a little further out because they're still going to shrink down some more. So we don't want to buy in clothes until they've had a chance to shrink down.
What about dress sizes? Because when I look at this before and after, I mean, that's a huge difference.
That's a huge difference.
Okay.
So it can be 3, 4, 5 sizes.
But they're also losing weight. I mean, this person had to have lost some body fat as well.
They lost body fat. They do lose some weight with the procedure, not as much as you would think, because everything's been focused. If someone goes and loses weight and they lose 10 pounds, they lose a little bit here, a little bit here, a little bit there. They've lost a little bit all over, and that's why they never really see that big of a difference. We've focused everything into these areas so that while they may lose some weight, it's really shape and contour that they've gained.
You say sometimes it gives people a second chance.
Absolutely. Well, it gives them a chance to get back the shape and contour that they had. I mean, things that they may have lost with pregnancy, lost with time. I had a patient the other day. She's like, you know, I want to get this done because I want to go to the gym, but I won't go to the gym the way I look right now because I think everyone's going to be looking at me. So,
really?
Yeah. She's like, I want to get that shape and contour. I'm going to go and do the rest myself.
Do they eat better after this is done? Do you tell them?
Absolutely. We absolutely sit down and talk about with that portion there. And the motivation is there because they see what they look like afterwards. I've had people say, you know, I want a picture because I'm going to put it above my treadmill. So every time I don't feel like working out, I'm going to look at that and say, I don't want to get back to where I was before. If they lose weight on top of the procedure, they're only going to get a better result.
Now, the critics could easily say, what's wrong with diet and exercise?
Diet and exercise is great, and many of the people that we see, I mean, that's what they've been through. They've been exercising. They're going to the gym a couple times a week. They're walking. They're running. You know, they've went as far as they can go, and now they need some help. They need a boost. They need the shape and contour. Some of it's genetics, hereditary, that they would never get to that level on their own. So on this patient, we did the abdominal, upper and lower abdomens. We did the waist. We did this lower back, upper buttock area, got into the little bra fold, a little area here. And look at the rear view. Look at this this view here.
Same woman.
This is the same woman. You're going to see how we've marked out the areas. We've marked out into this little bra fold, the shape and contour, but the focus is really down here because we want to bring out and accent the curves that she already has. And you look at the picture here in the afterwards.
She gave her a waist.
So we gave her a waist. Like I said, she feels so much more comfortable. She can wear anything she wants, from low-cut jeans to a tight shirt that even shows a little bit of belly there if she wants to. So here's another patient, and we're gonna show you the back view. We're gonna look at these bra fold areas here. We're going to look at the waist. This is a patient that had 6 children, and she had really felt that she had lost the shape and contour. She was no longer comfortable wearing the tight-fitting clothing. You know, she goes out to activities and things with her kids, and she doesn't feel comfortable. So on the front view, we can see that this area here, this is something that many people would look at and say, wow, that patient needs a tummy tuck.
Yeah.
She didn't want the scar. She didn't want the downtime and recovery time because she's out there.
But will her skin bounce back, though? I mean, with that big of a bulge?
Absolutely. The skin is very elastic. We're combining a tumescent procedure. This is someone that was done before we had thermal lipo. This is someone that we definitely would offer a thermal lipo now to try to get skin tightening. But you look at these areas here, you look at the waist, you look at the shape, you look at this bulge here. This is someone that wouldn't wear tight-fitting clothes. But now I want you to take a moment, look at the afters. I mean, look at this back area here.
Doesn't look like the same person.
Doesn't look like the same person. So, but it is. Absolutely. You look at the shape and contour, you look at these folds, these creases that used to be there, they're gone. So
how long does that take you to do, by the way?
The patients in the office.
This one time?
This is one session. We try to do as much as we can to be cost effective. We want to be safe for the patients also. We try to do this all in one procedure. And these pictures, like I said, are at about 6 weeks afterwards.
6 weeks, because it looks like, again, she lost 50 pounds. Doesn't look like the same person from behind or from the front.
So, well, that's the
buttocks is completely different. You didn't touch the buttocks on this?
Didn't touch the buttocks. We just taper into this upper area here to bring this contour change in here. The front, you can see the skin came up with the support from the garments they wear afterwards and the procedure itself. The skin's elastic. It is able to come up.
How soon can they go back to work? Somebody goes in on a Thursday,
Someone
Friday.
can have a Thursday procedure, Thursday, Friday. Monday, Tuesday, they can be back into a work type setting. It really depends on the individual patient. They can tell me more as to how they're going to do.
Do they ever, without your consent, go to work anyway?
Well, there are people that have been called into work. I had someone that worked at the border, and she got called in on an emergency the next day. She was working. I've had people do it. I really recommend you have a couple days. The patient can tell me more because they know how they feel, how they recover from things that they went through in life. And so they're going to be able to tell me when they're ready to go. It depends on how strenuous work they have to do also.
Okay, now we're going to take a quick break. We have time for probably 2 more before the break. So what are we looking at over there?
This is another patient here. This is an active person. She's actually in the military. She's just found that after having a couple children, she can't lose what she'd like to. I mean, she has good shape and contour hiding underneath there. It's just that you can't see it right now.
And this is the thermal lipo?
She had thermal lipo. She has some stretch marks, a little laxity in the skin there. This is 6 weeks afterwards. You can still see some of the marks that she was still wearing the garment to help support the skin.
She's got to be happy. It's an athletic look.
She's an athletic person, and now she has the look to go with it. Here's another patient. Once again, you look at the little bra fold area. We're going to taper up into that. We're going to give her a waist. This patient doesn't have shape or contour. She looks very blocky. We'll see patients that look like that after they've had a tummy tuck. They're super flat in the front, but they don't have shape. And
yeah, no waist at all.
No waist at all, and that's what we can really give them. And people look at this. Look at this after.
Wow.
I mean, look at that waistline. Everyone looks at that and says, you know, we've done something with the buttock area, but we really haven't. The folds, the creases are the same there. It's just that we've brought out that waistline.
It's very smooth, by the way, and these aren't touched up.
These are not touched up. Like I said,
I'm going to have to put results not typical on this. But is this typical? I mean, if you decide to go with a procedure, can you tell them the results in advance?
At the consult, we really try to determine what the results can be because it's really the muscles. So if someone has muscles hiding underneath there like that, absolutely we can give them that result.
Because this is an amazing result.
That's amazing. And the procedure really is amazing. If they had shape and contour before, we're going to bring back what they have.
What does she say? What does this woman say to you?
Oh, she's amazed. I mean, she came in with a whole new wardrobe. She's like, everyone at work is looking at me, asking me, what did I do?
Do they keep it a secret? Do they say, I'm just on a new program?
Yeah, some do. Some just say, oh, I've been working out and watching myself, and others are very honest.
So all their friends are killing themselves at the gym now.
Well, some are, but some are very proud of the work that we do.
Yeah.
And share with they'll have people that come in and say, I'm a friend of so-and-so, and I know what you did for them. What can you do to help me?
We're going to take a quick break. We come back, more photos. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are talking about Thermal Lipo, and we are here with Dr. Nowak. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. It's all about liposculpture today with Dr. Nowak, and it's Therma. I want to make sure I'm getting that right. Therma?
It's Thermal Lipo.
Lipo.
Yeah, so
I was calling it thermal, I think, for a little while at the beginning of the show.
Yeah, it's like I said, it's a combination of two techniques: the liposculpture,
so radio frequency,
tumescent liposculpture with radio frequency. It's not officially a laser. Some people will call it a laser, but it's a heating of a collagen support network.
Is it gimmicky? I mean, could another physician tell me, hey, Randy, that's gimmicky?
So.
Well, could they say that?
No, because you can get tightening just with Thermage alone. If someone comes in and doesn't need shape and contour, they just have a little loose, lax skin, they just need some Thermage. And we can tighten their skin just with that. If someone needs shape and contour, as well as needs the tightening, we combine the two procedures. We're getting more skin tightening. There's studies done. We actually did a study with Thermage where we did a split body. We did lipo all over, but we did Thermage only on one half. Yeah. And four out of five patients in 2 days could tell us that them or their family could tell us which side was done with the Thermage because it looked tighter, it looked
combo procedure. Now, you were doing it the other way for many years. How long have you been doing lipo, by the way?
14 years.
14 years. Okay.
So typically they were done separate. We would do the lipo and then we'd wait. And if someone said, boy, I do wish I had more skin tightening, we would go with the Thermage afterwards.
So you're sold on doing this together?
I'm sold on doing it together. The tightening that we get the best results if we do it at the same time. We can still get people a nice result doing it separate, but if we do it at the same time, we're going to get them a better result.
All right, we're in a rush, but these are some good photos.
Here's another one of our patients. She's actually in excellent shape. She's actually a size 2 or 3. She's lost as much as she can, but she doesn't have shape. She doesn't want to lose any more weight because she's going to lose it elsewhere.
And they're awake during this procedure,
They're awake during the procedure. Absolutely. They walk out of there under their own power. They're talking to me during the procedure.
So what kind of anesthesia are you using? I mean,
well, we use some medication in the Valium family to relax them, a little bit of pain medication, but the rest is just local numbing medicine.
And that's why it's safer.
And that's why it's safe. No general anesthetic, no IVs, not knocking them out. Now, I want you to look at the after because, you look at, we're really at the same distance with the patient here, but you look at the waistline, you look at the shape and the contour that she has, and next thing is to look at her legs. Her legs look more balanced, more proportionate.
So you didn't do anything to the
So
legs.
we didn't touch her legs. We just shrunk
That's
the
an
top
athletic
part
look.
down.
She looks good.
So
It's a hot look. Very good.
she's got a good look. She can wear that hot little black dress. You know, she can be comfortable in her low-cut jeans. She can be comfortable showing her skin. You look
Wearing
at how
a
smooth
bikini
the
or
skin
whatever.
is. Wearing a bikini, absolutely.
All right, now what is that? Is that her rear view right there?
This is the rear view for her. So once again, you look at how much of a waistline that we've given her. You look at how smooth the results. The marks are only about as big as a pen. You know, you can barely see any marks on the skin at all. Here's another patient, and you asked about, you know, can it be faked? This is a shot that you cannot fake. I want you to look at this before picture.
Because I asked you, are they sucking it in?
You asked me if they're sucking it in. Try this. This is the patient leaning forward. You can hold your muscles in, but you can't hold your skin in. This is a patient that she was ready to have a tummy tuck. She thought it was her only option. She came in, heard about the thermal lipo procedure. She actually went on TV on the Inside San Diego because she was so thrilled with the results. You look at this afterwards.
So thermal
look at
lipo.
this is thermal lipo. So this is the skin tightening. You look at how much this comes up. She's leaning forward. That skin's not moving. That skin's held in place. Here's another patient here. Very typical area. Very typical patient that's in good shape.
Yeah, very lean.
Very lean.
Just a little like love handles.
But yeah, absolutely, she doesn't have a waist. You know, she doesn't have a waist here. She had several children, had the little pooch here in the front.
Wow.
You know, really was tiny, you know, a size 1 or 2, but didn't have shape. You know, you look at the patient afterwards, how this has been brought all up. Nice shape, nice curve in here. I mean, she can really wear anything she wants.
All of these were just about 6 weeks out. These
The pictures are taken 6 weeks out. You know, this one I really want to share with you because this actually changes someone's life.
That's a big patient.
This is not, you know, necessarily a typical patient, but this is someone that we made a huge difference for. And this is someone that's had a couple children. I mean, this is a person that's not necessarily looking to be a swimsuit model, but wants their clothes to fit differently, wants some shape and contour that they've lost. And like I said, you look at these areas, you know, this was with lipo alone. We're able to bring this down.
Would a lot of guys, a lot of other doctors maybe not touch this case? In your opinion?
There are people that won't touch this case, but this was a patient that was realistic as to
So
what she
you'll do
was
the bigger
looking.
patient too.
This is someone that was realistic as to what she was looking for, what she was going to be happy with, and she's ecstatic because, like I said, this
Big improvement.
a huge difference. I mean, she came to on Monday. She was ready to go to work. You know, her clothes fit completely differently for her.
But they still have to eat better.
Well,
I mean, somebody this large,
absolutely they do.
they could get in trouble again.
Some of it's genetic, hereditary. You know, they're going to gain weight. They're going to gain it elsewhere before they'll gain it back in these areas. Absolutely, they're going to eat better. Many people, this is what they need for motivation. We're giving them a second chance.
All right. Okay.
We're going to give them a second chance. It is up to them to take care of it. I'm going to do everything I can to get them the best results. Okay. But then it's up to them to take care of it, and they do have to do their part. Absolutely. Here's another case here. This is the saddlebag areas, and this is a common complaint.
Wow.
This is something that her whole
Is that
family
unusual?
had. This is a little bit unusual because she has really good shape and contour proportions up top, but if you look at the hip area,
Very small waist.
very small waist. She has to buy her clothes based on those hips. You know, things don't fit her up top. You know, this is something that diet exercise is not going to change.
So, but you say even thin people could have these.
She's really thin up top. She's a
gathering
tiny,
of fat on the sides.
Yeah, she's a thin person up top. She's not big. It's just genetically she has these legs. Now, like I said, you look at the after. I mean, this changed her dramatically.
Yeah.
Look at how much we've smoothed this out. You know, we've touched a little bit on the inner thighs and the knee area here. Gave her some more sculpture. You can see the tattoo, so there's no doubt that this is the same patient here. Absolutely, and this is 6 weeks afterwards.
You have a male patient right there.
Yeah, we have a male patient. This is a tricky area, you know, a tough patient.
The breast.
You know, the breast, the man boobs. This is a guy that came in, didn't feel comfortable going to the pool, didn't want to wear a tight-fitting shirt. He was out there in the public a lot on his job, but he wasn't comfortable. And really look at him afterwards. I mean, you look at how smooth we've brought this down. I mean, this is a guy that he can go out to the pool, he can be comfortable, he can wear a tight-fitting shirt.
Is this result, was this with thermal lipo too, or you didn't need to use it?
This was in the time before thermal lipo. This was just a standard tumescent liposculpture procedure. This is someone that we would definitely offer a thermal lipo procedure because he did have some stretch marks and there was a lot of fat for us to work with there. So this is someone that definitely could have benefited from that.
So now he's wearing tight shirts, looking good.
He's looking good, but we could have shrunk him down and tightened him up a little bit more. Had the skin probably doing a little bit better there for him.
Okay. Last one. We have neck. Is neck a popular area?
Neck is probably the third most common area. The recovery is a visible recovery, so it's something that the patient has to have a little more time off from work potentially because there can be some bruising. But it's something that really bothers the person. This is something, arms are another area that people come in, and it's something that other people don't necessarily notice, but they look at it every day and they say, you know, what can you do to...
people with bigger arms.
Absolutely.
You like doing the arms?
We're happy to do the arms. If they have a good muscle, good tricep underneath there, we can sculpt and bring out the shape and contour that they have there. And you know, you have anywhere from people that want their clothes to be able to fit better.
How does that bounce back, though? I mean, does it bounce back okay?
Particularly with the Thermal Lipo, we can add that thermage for that skin tightening to bring it up. It does bounce back. The marks are tiny, about the size of a pen, you know, hidden in the crease, hidden by the elbow. So little or no marks on the skin.
Do you ever do full body lipo where they're doing the arms, you're doing the abs?
Not in one procedure. Not in one procedure. You know, safety is our #1 concern. I want to give people the best result, but I want to be safe. I mean, realistically, we want people to enjoy the result. So there is safe levels, and we want to stay within that. We want to do as much as we can, but we want to be safe.
Final message, somebody watching this, considering lipo.
Well, if someone has been through diet and exercise and they can't lose those areas, they've lost some shape and contour of pregnancy, I really invite them to come in, have a consultation with me, meet with my consultant, and we'll show them what we can do to help them.
All right, I want to thank you so much. And all of these photos are on your website as well?
The photos are available on the website, as we have some videos there also. Thank you very much.
Thanks for coming on the program. Very interesting. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.